And as usual, as such, there are things which we would like to start with. He has already introduced. हर घड़ी बदल रही है रूप जिंदगी, छाव है कभी कभी है धूप जिंदगी, हर पल यहाँ जी भर जियो वो है oh no. So the thing is constantly is changing, treatments are changing. I'd just like to start with few of the things as such. And yeah, one second. This is a thing called Integrative Oncology, and we are trying to. It's just a case of a disclaimer here. We are not trying to fit into your shoes or something like that. We are just trying to work out on some issues where yeah. This is a thing as such. We started working on some alternate therapies and all that. Later we thought that okay, we thought ozone is one of the alternate medicine. But I can always tell you, my patients, they come and Dr. Garu, adi ozone therapy adi ivandi. This is a Telugu language, sir. The people are asking us to go particular for that. So what is the role of non-toxic treatments in cancer care? We are just going to discuss it here. And how we can combined with the conventional therapies as such. What if the chemotherapy, along with that, people can give vitamin C or not? I can always tell you with methotrexate it doesn't work, whereas with other things it can work. So we are working on some things like vitamin D supplementation. We are talking about vitamin C, heavy dose of vitamin C, curcumin, boswellia, ozone and hyperbaric oxygen. Of course, detoxification is my major things as such. I believe that we all clean our faces with a good face wash and all that. The only thing which we miss out is our internal cleansing is not proper. I believe that a person who is sweating a lot, he is much healthier than a person who doesn't sweat as such. So our approach is slightly different from the conventional oncology. We, as I told you, we are trying to focus on the person rather than the patient. We are talking about cancer physiology. I can just give a smallest thing as such. You have got a plant, you have got a fruit which is maybe fruit has been diseased as such. We are now, the concept here is you need to treat the roots also. Along with that, you need to see that the surrounding soil has also should be treated, then only you get a good yield as such. So what are the integrative therapies which we are working on? Already said by so many other speakers as such. And the thing which has been told by Otto Warburg and there are other people, who I'll just show you, the crux lies, if we see something as only genetic, we may not offer some solutions as such. I can just give you a simplest example. I have in my family members and other friends and all that, they say, Doctor Saab, wo diabetes aa gaya. The thing is, they are not talking about, they say it is running in their families. So what we are not looking at that is something called epigenetics. If the diabetes comes to a 65-year-old man, if your grandfather becomes diabetic at 65 years and your dad gets at 50 and you are getting at 30, it is not purely genetics. If it is purely genetics, it should come only at 65. So there are some environmental variables which we can always correct it and we can work it out. So with the assumption, if we go, okay, cancer is a genetic thing, okay, BRCA gene is there and we are going to get it, then we can't do any much of treatment as such. So we feel that it is most of the mitochondria, if we can look at the mitochondrial angle, cancer mitochondria, I'll show in the subsequent slides, where there is a meaningful treatment can be offered just by correcting the mitochondria. This was the great man who was Otto Warburg. He won a Nobel Prize in 1931. He was the guy who action of respiratory enzymes and all that. This is cytochrome oxidase and all that. He worked a lot on that particular thing. And he conceptualized one thing. What is the difference between a normal cell as well as a cancer cell? He said there is a difference between, the difference is only thing called Anlom Vilom. Anlom Vilom is respiration. Same way the cell respiration also occurs. There is a thing called mitochondria. You have oxygen, and if you have glucose, oxygen properly combusted, it results in aerobic respiration, which results in good number of ATPs. If oxygen is lacking, or if your mitochondria is defunct, then whatever oxygen is there, whatever sugar is there, it's not going to get combusted properly. It goes into the anaerobic cycle. So what he said was all cells, normal cells, are running with the aerobic mechanism, whereas all cancer cells, irrespective, they run into this particular mechanism with the anaerobic respiration. So what happens? This is the thing as such: differentiate normal tissues, which gives oxidative phosphorylation, and very less is anaerobic glycolysis. Whereas this cancerous tissue are predominantly, they are being done with the anaerobic glycolysis, which causes a lot of packages. So the chronology of Dr. Warburg's tumor and cancer discoveries that led to metabolism of the tumors. Metabolism of the tumors is one thing. If we can understand that, we can do some good progress here as such. Dr. Warburg was talking about oxygen cancer connection, and they have done it was a lab study. They reduced the oxygen concentration to less than 33%. To any normal cell, and it turned malignant. So this was the thing as such, and he was a very big proponent of deprivation of oxygen. Later on, after Warburg, there were some discoveries which were done as such, and this is the most important thing. Warburg's seminal CA cervix cases and all that, it was shown that the cases which has got a good kind of the cancer tissues, the intratumoral oxygen saturation was measured in the cancerous tissue, and the cases where high levels of this one were there, they were amenable to good radiotherapy and good chemo and all that. Yeah. Diabetes तो आना ही है, so you can't go further as such. You have to follow some other things so that we can. I can bet people, even if we have BRCA gene which is positive, and if you are doing some environment, you are trying to detox yourself, trying to see that. Hi sir. If you're doing good detoxification, if you're doing something like oxygenation and all that, you can definitely postpone the cancer event which is going to come as such. I don't say you can always get away from that, but you can always postpone that. This was the subsequent to Otto Warburg theory, this was Dr. Robert Greenberg, and he was a major proponent of the genetic causes of cancer. And he was highly critical of Warburg, and he has, okay fine, this was being written on this as such. But what happened later was, I'd like to show you, he came up with a textbook of cancer, where he was able to show it's only genetics which causes cancer as such. In 2007, he rewrote his textbook, and he said, he admitted that the genetic basis of cancer was wrong. He tells basically there is a connection between inflammation and cancer was worked out by this same gentleman, and the major underlying feature was inflammation plus oxidative stress, which is resulting in cellular hypoxia, is the major cause which results in cancer. Later on, let's go back to some of the work which is being done by people. And this is Warburg's supporter as such. He was in Johns Hopkins. He produced several hundreds of articles, and he was along with that Dr. Leninger. I remember reading his textbook also during 1985-96. We were 85. We joined biochemistry, and I remember this gentleman. He was a strong this one, and following that, Warburg and Pedersen, they also showed this particular stuff. And again, coming back to key discovery about cancer metabolism, this gentleman, along with there was somebody else called Pedersen, they showed that a high rate of glycolysis in cancer cells is dependent on hexokinase 2. Hexokinase 2 is again the there is a kind of over the mitochondrial membrane. This hexokinase 2 was studied again by Richard Nakashima, and he showed that HK2 binds to this particular mitochondrial membrane, and you have a problem with that HK2, it is definitely leading into cancerous tissue. Because this hexokinase 2, this is a research work, and adding this, we started doing something called ozone therapy some years back, and we used to check every patient for G6PD deficiency. G6PD deficiency, if it's deficient, that we had seen all cancer patients, irrespective of that one, they have very high levels of G6PD. So that also is a marker for us. Yes, the moment somebody comes with G6PD about 21, 23, we feel that definitely there must be some problem with this metabolism and all that. We don't do G6PD if it is less than 8 or 9, we don't do ozone therapy because it causes lysis and all that, RBCs and all. So this is one more guy who is Thomas Seyfried, and he has written a book on cancer as a metabolic disease, and he had a very good clarity as such. He's a biologist basically, and he was talking about how sugar can increase the things and all that. What I can tell you is, if I can just take your attention, simple, if I can explain what Thomas Seyfried has to say. Thomas Seyfried had a clear kind of thing. He said, try to starve the cancer tissue, cancer cell, by not giving glucose. According to the theory of Seyfried, he says, all the kind of, there is a feedback, what happens is that upregulation of glucose things appears, and when all the cancer cells, it was found that it was 19 times more insulin receptors are there on the cancer cells. Normal cell doesn't have that kind of thing. So whatever sugar is thrown into the field, cancer cells, they latch up because they upregulated the glycolytic enzymes as such. So they are always hungry, they want sugar as such. What if we stop giving glucose to the patient? The normal cells do survive without glucose because they can survive on gluconeogenesis also. They can survive on lipolysis also. They can get ketone bodies from the fat, and that can also survive the normal cell. Whereas the cancer cell, it gets perished just by stopping that glucose kind of thing. So this is one of the things what we have been talking is try to see that the intake of the glucose in any form, whether it's in the milk form, it's the rice form, or whatever refined sugars and all that. I can always talk about milk and all that in the later things as such. But this approach was wonderful, and he had his disciples. One of them is, I'm going to meet this guy in, this is Joseph Mercola. He has produced a book on tripping over the truth. And he writes on a useful newsletters also. And what he has told, he has shown in the book Tripping Over the Truth is very simple stuff as such. He showed the theories of cancer viruses or mutational theories, and he is for us, I think with all this data, we need to have a relook what we are, somewhere are we missing any point as such. This is one fantastic, I'll just go back. We see Otto Warburg told low oxygen causes cancer. Low intracellular oxygen causes cancer. What is that low? Why the oxygen is very low in the cells? Now this guy, the Brain Peskin, he has come up. Brain Peskin, as I know him as such, he's basically engineer first. Then he was a physiologist, and he showed in his hidden story of cancer, most of the problem which I can relate in our day-to-day life is because of the refined oils. Refined oils, if you can just go back, whatever oils what you're using in your home, we are trying to go with the labels. We try to pick up a very clean and neat kind of stuff. Refined oils are preheated to very high temperatures to remove the odor of the oil. And when it is so much preheated, it becomes trans fat. So the trans fat, omega, this particular stuff, it goes and blocks the cell membrane. Cell membrane is made up of all this only, phospholipids only. So all the trans fats which goes into the phospholipid cell wall, that becomes a closed doors are there. So hypoxia is the first thing which happens there. So this is one thing we have been working out. Maybe we all have to tell our patients, start using cold pressed oil. See that the heat should, it should not use that kind of thing in this heat as such. And again, there were studies as such, but somewhere there is somebody missed that particular top point as such. The oils which normally Indians tend to heat, puri, everything and all that. This is a real tricky thing as such. And again, that we can explain as such. I'll just take out few more issues as such, which this is a big issue which is called adulterated fatty acids because of this oil industry. And I certainly feel the ghee which was used before, and that is certainly the better one. So we need to tell our patients and all that how to go ahead with this oil as such. There is something else I'd like to talk about when I'm talking about this is there is a thing called false placenta theory. I know there are some gynecologists here. False placenta theory of cancer. This was put up by first John Baird was a guy who postulated this theory. What he said was it is really it deserves kind of thing as such. He said sorry. John Baird, this is the placental theory, false placenta theory. What John Baird says was, and there were subsequently Nicholas Gonzalez took up that. There are some other people. In fact, Nicholas Gonzalez was sent to Dr. Kelly's hospital. First was John Baird. He was followed up by Dr. Kelly. Dr. Kelly, I'll just mention a few words about him. He was a dentist. He came up with a pancreatic cancer, and he didn't know what to do. He had a big pancreatic mass, and nothing worked for him. He used to have intense, so somebody suggested him to take a pancreatic enzymes. And he started taking the pancreatic enzymes, and he felt so well. And he, out of this one, he started taking mega doses of pancreatic enzymes. So pancreatic enzymes was the thing which helped Dr. Kelly. Kelly was a dentist, and he started his pancreatic tumor was it came into remission, and he started treating other people as such. It's a kind of thing, and he went on to produce some papers also, but it's a big story. And Nicholas Gonzalez, he was sent. He was doing his MD this one as such. He was doing a. He was sent by to understand what is he doing as such. Nicholas Gonzalez goes to this man, see all his cases and all that, and he was totally. He told. Later came out this placenta theory. What false placental theory? I just want to give a small glimpse as such. What happens? What is this structure? This is the placenta. If I tell you this is not a placenta, if I tell you it looks like a tumor, very vascular, all tissue, fibrous tissue. You have got full veins and arteries. Yeah, placenta looks like a tumor. So what this man has to say was, there is a thing called trophoblast. During the evolution, during the pregnancy, the child stays in the mother's womb for 9 months. So during first 10 weeks, the spinal cord, spine appears. After some time, cardiac appears. We see on ultrasounds, heart is so nicely seen. But the pancreas is the sub-organ which appears only during the birth. Pancreatic enzymes start releasing only during the birth. And it was this guy, John Baird, postulated that there was a trophocytes, this which looks like a tumor. It's a very aggressive. It latches into the wall of the uterine. It has angiogenesis. It takes all the feeding and all that. It looked like a placenta. So the thing that was postulated by Dr. Baird was the kind of delivery. What changed in the cell metabolism is pancreatic enzymes, they started going up. So the moment the pancreatic enzymes started going up, hasn't, it starts getting atrophic. So that was the basis of enzyme therapy. We started giving some good quality of enzymes, pancreatic enzymes, and you can always Google about this. There's a lot of literature about that. Just by giving the enzymes, we can definitely see that there is a regression of these trophocytes. Trophocytes are getting better. So I started working on this particular stuff. Curcumin, I like to, he's a good friend of us, Dr. Bharat Agarwal. He did, from BHU, he did biochemistry. He was in Banaras Hindu University. He did biochemistry. Later left, he shifted his thing to US, and he was the head of the experimental therapeutics in MD Anderson. He did a lot of work on curcumin, and he has produced so many papers and all that. This is his book as such, and the thing is, it's a very easy thing. Adding curcumin in your diet and all that, it will be a simple thing as such. And maybe I'm just trying to explain what comes under integrative medicine. We can always take up piece by piece meal. I'm just trying to do that. This is one more doctor called Keith Block, and again he was putting up on all stress management and all that as such. And this is again, this is what we somehow don't advocate now. Dr. Block emphasizes a low-fat diet. Low-fat diet is not helping out anybody. You need to have a saturated fats also. You need to have a not trans fats, and it is going to help you. Dr. Leroy is also going to talk about that. So there are always some problems with the integrative oncology also. There are how we are increasing, how we can improve results of our friends with doing hyperbaric oxygen, ozone and all that. So these are some of the areas, the therapeutic interaction of nutritional substances with chemotherapy. The thing is, to be precise, the knowledge is very limited. There are very less number of studies are there as such, and extrapolating laboratory data to humans is slightly difficult. And we certainly feel that there is a lobby which says not to use intravenous vitamin C along with whenever you are giving radiation and chemotherapy, because chemotherapy and radiation is causing free radicals, and you are giving antioxidants, vitamin C, it is going to preserve that cancer cells. The thing is, we are using vitamin C as a pro-oxidant therapy, not as an antioxidant therapy. We are giving very high doses. When we use vitamin C as a pro-oxidant therapy, it increases how it works out is it increases the oxidative stress, tries to do a works as a catalase and glutathione peroxidase and all that. This is the support of there were some studies. The interesting study was by Kedar Prasad, and he showed what is the rationale of doing antioxidants along with this particular thing. And I can always ask any one of you, what is the vitamin which is going to be anti-cancer vitamin? Which is if you have this vitamin in abundance, you're not going to get cancer. Tell Dr. Jarani. It is vitamin D. B17 is a creation of this WhatsApp and all that group. If you keep your vitamin D about 60 to 80, yes, Chakravarti sir, if you keep your vitamin D between 60 to 80, you're not going to get into any of the oncology, any doctor also. Yeah, it has to be understood very properly. And this is testing of vitamin D and all that. We still feel all Hyderabadis have less than 10 or something like that. It is something related with the toxicity issue. This is the guy who talks about this one, Cedric Garland. He talks about genomic theory actually, and he says if we have a first less vitamin D, disjunction is the first thing that happens, and later on things will go in a different way. And there is Dr. Suresh did mention about macrophage activating factor and all that. We were trying to work on this GC map, it's called. GC map, I'll just give you a simplest example. I have been trying to find out where this Nagless test is being done. Thyroid said no, there are nobody wants to do this Nagless test. I can tell you, if there is any one single test which will tell you you are predisposed for cancer or not, it is Nagless test. If your Nagless test is high, you try to go into you are definitely a candidate. You are pre-cancer. You are into pre-cancer stage as well. So what happens with high NAGLS? This viruses and cancers, they produce high NAGLS. That this reduces the GCMAP production, and by giving this GCMAP, we can always go ahead with that. And there were a lot of studies which was done with the vitamin C. I just want to highlight on this one particular thing as such. Is it safe or not safe? There's a lot of studies which were done. I just want to highlight on the studies which were done by Dr. Dattatreya. Vitamin C studies were done by the Riordan as well as Linus Pauling and all that. They used intravenous vitamin C. 10 grams were used. And there was a counter study which was done later, which showed it is something like they gave 5 to 10 grams and that was given orally. If anything about 2 grams you give orally, it is not going to be, it's not going to be absorbed. So that study was also, it was some kind of thing. And I try to use naltrexone as well as alpha-lipoic acid more as such, and this is again documented. It's a very simple thing. I'm sure Francis is going to talk about as such here. And this is what I'm just trying to give a rough sketch what integrative medicine can do. We can always, the way we are doing metabolic therapy is to stop this efflux of lactic acid. If you stop this efflux of lactic, see what happens whenever there is an anaerobic glycolysis. You start end products are pyruvic acid and lactic acid if they are made abundantly. And this goes out of the system, causes systemic acidosis. And if by any chance, if you can stop this pyruvic acid from coming out, that itself causes apoptosis. Itself distress. And I have told about other things as well, restricting glucose and blah blah. And glutamine is, again, we see it as a slightly double-edged sword. There are some cancers which can metabolize glutamine like anything, and we can always. This is the most important thing I feel. This is called light at night hypothesis, which is the reason for all metro cities, all India and all that, pan-India, people are getting into problems because of this particular light at night hypothesis. It is not just, the thing is, the studies were done in staff nurses, the studies were done in corporates who run, say, this one asset software people. The people who are working in a bright light at night, they are more susceptible to cancer. It is only because you are trying to, there is a thing called pineal gland which secretes melatonin hormone, and your pineal gland works till 40, it's normal. Slightly there is a depression of pineal melatonin synthesis, and with that you are trying to decrease, if you don't follow the proper light kind of thing, you are not properly using at night as such. So your pineal gland is a very sensitive organ. Even a light, a flash of light also, you look into that, it disrupts the reticular activating system and it stops the production of melatonin. You need at least 6 to 8 hours good sleep, and that melatonin is formed only in the darkness. We cannot change that particular thing. So this is, we use melatonin a lot in our practice. Melatonin, along with that, we are using now hyperbaric oxygen. Hyperbaric oxygen, I'm going to talk a small talk about that. Hyperbaric oxygen, how it is helping out here is by there is an increase in oxygenation. I told you about cellular hypoxia. If we are able to get past that cellular hypoxia, things will definitely improve. There are some do's and don'ts, and we do something called, Dr. Ramon, we do something like infrared sauna. I started infrared sauna some time back. It was way back. I started using for my autism kids and all that. And I never thought that machine is going to help me so much now. We make patient, we make them sit into the chamber. It is causing detoxification, and at the same time it causes hyperthermia. And tell me, I can bet on that. Take any cancer patient, see his basal body temperature. They are having low body temperatures always. It's a paradox again. In summer, cancers are not reported much, and in winters, I'm talking about in the US and all that. But again, you increase the body temperatures. When the body temperatures are high, cancer is not going to enjoy. It survives, but whatever. And we started on this particular piece, and I started doing something called pulse electromagnetic field also. And pulse electromagnetic field, what it does basically is, when we are talking about cell membrane, there is a thing called electromagnetic field which shrink tumors. And what we do in that therapy is we make the patient lie down on a bed of magnetic field, and with that what happens is that there is something called electroporation which happens. The cell membrane, when there is a thing called sodium potassium ATPase. You have got that cell membrane permeability. The sodium goes in, potassium goes out. All depends on that pump. With all cancers and all that, that pump is defunct. It doesn't properly work. That's the reason you see a lot of sodium inside and a lot of potassium outside. So what happens? So what we are doing with this PMF is we are trying to create a holes the cell membrane by this phenomenon called electroporation, and it's a very simple thing as well. Again, I think I have taken much time, but I'll tell you why I am into this integrative medicine. I happen to treat one of the hepatoma cases as a radiologist. I got it of cloud 9. I thought, oh, that's a super thing. What we did was, there was a family friend of us. He had a hepatoma, and we picked up. It was 15 years back. 12 years back. So this is a 50 years old gentleman come with a hepatoma, which is about 4 centimeter mass, and the prognosis was given, and they were ready to do something. I picked up. I was in Sanjay Gandhi. It's a long time back. So I picked up from Dr. Baijal. There is a thing called percutaneous alcohol injection into the tumor. So, hi Sriram, please come. Sriram, please come. So the percutaneous ethanol ablation was tried for one of my patients' assets. What I used to do is, ultrasound guidance, I used to enter into the liver, into the tumor, and I used to give 3 ml of absolute alcohol. So fantastic. We started doing percutaneous hepatoma, sir, what we are talking. This brought me into this picture. So I never realized alcohol giving directly into the tumor. There was a shrinkage, and the patient went on to live more than 5 years back. So slowly I started working on that. So this is one of the cases. I just want to show you some of the cases where I did see, this is the case which was a cholangiocarcinoma. This is a well-defined tumor which is sitting over the porta hepatis, over the CBD, which is causing this patient had a bilirubin which was about 20. Nobody wanted to do anything for this lady. She came with a pure this one as such, and we started doing. I did use alcohol. I did use ozone also. Ozone was a very easy thing to go ahead. Once we entered this lesion, giving ozone is the very safest and easy thing. We started doing this kind of thing as such, and over a period of time, this was a carcinoma gallbladder with liver metastasis. Within a gap of almost 5 to 6 days, we were able to get down the bilirubin directly. It was just by that kind of injection. I'd like to show one more of my case as such, where we did intratumoral injection. See, this is a mass as such. It is basically, this was a pelvic node, and this is one case we have been following for this case as such. It was a uterine sarcoma. It was one of our anesthetics who got the problem, and uterine sarcoma, they were doing a lot of things as such. It is a big mass. Post chemo, everything was tried. It was not amenable to surgery, and we did start giving ozone injections, ultrasound guided, into the tumor. And I can show you, if you are able to see, there are some cystic spaces. On ultrasound, we try to pick up solid lesion and cystic lesion. So while doing this process, we were able to change the solidified tumor, which is a mural, this kind of thing, into a cystic lesion. Just by this particular thing. So this is, I end with this particular thing as such. Coming together is a beginning. Keeping together is progress, and working together will be a success. I thank one and all. The next, I think I have to work it out.
There are two questions.
Yes, I will.
Okay, later on.
Because I think we have already late as well. We have 3 more sessions for free lunch. I would acknowledge Mr. Kalyan Chakravarti. Sir, please come.